Many of us know family, friends, or neighbors who are providing care for family members full or part-time at home. In fact, myself, I have family that have done such. More than 1 million North Carolinians are already doing so. As our population of citizens 65 and older continues to grow, that number will also continue to grow. Over the last few years, we've made progress in this area, like establishing a state tax credit for family caregivers. But we've got a lot more work to do. As governor, my administration will build on these efforts to make sure care is more affordable for families with caregivers at home. We will work to create more transparency in healthcare billing and lower costs for patients and providers. Together, we can work together to ease the burden on our fellow citizens who care for loved ones at home.
Caregivers sacrifice so much to take care of their loved ones, and they deserve our support. These caregivers often face significant financial and health-related challenges as they take care of their family members. It's imperative that they get the support that they need. We must increase our state's awareness of and outreach to its caregiving population. We must streamline access to resources so that they don't waste valuable time and energy navigating multiple referrals and sources to get the help that they need. And finally, we must ensure financial and workplace security for our caregivers, including by expanding our state's FMLA policy. If we act now, we can build a system that will support caregivers and their loved ones for years to come. Everyone should have access to quality, affordable care that is supported by a fully staffed, strong workforce. North Carolina's existing nursing shortage has only been exacerbated by COVID-19, and our state must prioritize investing in our nursing workforce to support our aging population. As the nursing population itself ages, we also have to increase in our investment in community college programs so that we can reduce the barriers to enter the workforce. I've visited nursing programs like the one at Central Piedmont Community College, and they are educating the workforce of tomorrow. At Guilford Tech, the community college is partnering with UNCG and NCA&T to educate healthcare professionals from nursing aides to nurse practitioners in the same facility so that we can better meet the needs of our communities. We can also invest in nurse educator programs so that schools can train more nurses. And of course, we have to give nurses the respect and pay that they deserve so that they're encouraged to stay in the profession.
North Carolina is facing a massive shortage of healthcare workers, and as our population grows, so will this shortage. We need to make bolstering our healthcare workforce a priority, whether it's by training more healthcare workers in our schools, colleges, university, and workforce development programs, or making it easier for people who move to our state to practice when they get here. My administration will make filling the ranks of our healthcare workforce with well-qualified practitioners a priority. Another one of my top priorities is bolstering career training and workforce development, especially when it comes to healthcare. This means getting our schools more focused on academics and making sure more students are graduating college and career ready. Our economy is built on pillars. Those pillars are public safety, public education, healthcare, infrastructure, and housing. If you don't have each of those healthy, then more than likely your economy will not be healthy. The failures of Bidenomics have made just about everything more expensive, including rent and mortgages. As North Carolina's economy continues to grow, demand for housing outpaces available supply. As your governor, I will work to cut taxes and streamline regulations so you have more money in your pockets to be able to afford the housing that you need. I will also work with lawmakers and state agencies to ensure that our regulations are protecting consumers without placing unnecessary costs on builders that will just make housing more expensive for buyers and renters.
A home should be a source of security and safety, but for too many senior citizens, that isn't the case. We must work to ensure that older adults can age in the place of their choice with the services and support that they need. I applaud initiatives like the recent development of 271 new affordable housing units designed specifically for senior citizens here in Wake County. And I encourage and will incentivize more local governments to prioritize these types of investments. We must coordinate services across organizations to help senior citizens facing homelessness find permanent supportive housing. And we must invest in outreach regarding home modification services to keep people's homes safe as they age. Folks should be able to age in dignity where they want to live.